Hi everyone, I'm Dr. Coffman D'Annibale, and welcome to this week's GI Oncology update for the Rush Center for the Cure of GI Cancers. This week I'm highlighting three studies, one very exciting therapeutic study in anal cancer with nearly a year improvement in survival with the addition of immunotherapy alone, and two focused on precision of liquid biopsy in GI cancers. First up is the overall survival results from the very much anticipated phase 3 INTERACT trial that we had known that it had met its primary endpoint of improving progression-free survival, but we were all very excited to see the outcomes data and efficacy data of overall survival. So this trial looked at first-line advanced metastatic anal squamous cell carcinoma patients who were treated with chemotherapy alone, standard carboplatin-paclitaxel, with or without immunotherapy added on. And the PFS is what we've seen in the past, its primary endpoint, which it met. But what was really exciting was the overall survival differences. With the addition of an anti-PD-1 inhibitor, overall survival improved by over 10 months. And this was also associated with an increase in objective response from 44% with chemo alone to 56%. And we see a doubling of CR rates, nearly 25%, and disease control rates reaching up to 90%. Very impressive with a minimal addition in treatment in the first line setting for this rare cancer. Next up, I want to point out a French group that published using circulating DNA from cancer in a new way and an exciting way to improve our ability to prognosticate for patients with advanced pancreatic cancer. So they combined CT scan tumor volumetric measurements with circulating tumor fraction measurements in order to refine our prognostic ability in pancreatic cancer. So individually, patients with high tumor volume or high tumor fraction over 5% face significantly shorter survival. And when we integrate these two findings and make a combination score, it is now one of the most powerful predictors of mortality we have, outperforming either metric alone. And then next up, we see using circulating DNA from cancer in a slightly different way in HCC for the improvement of early detection. The multicenter Helio liver diagnostic study demonstrated the superiority of cell-free DNA methylation-based blood testing over traditional ultrasounds in early detection of HCC. So Helio liver is a DNA-based test that examines cell-free DNA from cancer cells and uses a pattern of DNA methylation on these cells in order to signal a cancer cell from HCC. And when compared to ultrasound alone or ultrasound combined with AFP, we see an improvement in detecting tumors less than 2 centimeters, where ultrasound failed to detect any early stage liver nodules under 2 centimeters, whereas the blood test successfully identified nearly 30%. This shift to liquid biopsy could drastically improve early detection rates for patients with cirrhosis. That's it for this week. As we see from these studies, the future of GI oncology is increasingly precise and data-driven. If you have questions or want to discuss these papers further, feel free to reach out to me at my MedStart email. Thanks for watching, and I'll see you next week.